From birth, every baby faces their first challenge, gravity. Each attempt to lift their head or kick their legs is a small victory, building the foundation for movement. But what if a baby seems unusually limp, struggling to meet these milestones? This is congenital hypotonia, or floppy baby syndrome. It's not a lack of effort. Something is preventing their muscles from getting the right signals. The question, is the problem in the muscles, the nerves, or the brain? Parents often notice their baby feels oddly soft, with arms and legs hanging loosely. These early observations are crucial. They prompt deeper investigation and support. Understanding hypotonia starts with noticing the difference and leads to finding answers and hope. Doctors and parents look for signs of hypotonia by observing how a baby moves and responds to touch. A classic sign is head lag. When pulled up, a floppy baby's head falls back due to weak neck muscles. Their posture is also telling. Instead of flexed limbs, their arms and legs lie straight or splayed, showing low muscle tone. When picked up, they feel loose, like a rag doll, lacking the usual resistance. This tactile difference is a powerful clue. It's important to distinguish these signs from normal variations. Some babies are just more relaxed, but persistent floppiness, weak cry, poor feeding, and little spontaneous movement point to a medical issue. These symptoms together signal the need for thorough evaluation. Recognizing these patterns early is key to getting help. The difference isn't just temperament. It's a sign that something deeper needs attention. Early detection leads to early intervention. That can make all the difference. When a baby is floppy, doctors search for the source: brain, nerves, or muscles. The brain and spinal cord are the command center. If injured or affected by genetics, signals to muscles may be weak. Sometimes the nerves, the body's wiring, are the problem, as in spinal muscular atrophy, SMA, where signals can't reach the muscles. The neuromuscular junction, where nerves meet muscles, can also fail, as in congenital myasthenic syndromes. Here, the message gets lost, causing weakness that worsens with activity. Finally, the muscles themselves may be faulty, as in congenital myopathies or muscular dystrophies. Even with perfect signals, weak muscle fibers can't contract properly. Each possible cause requires a different approach to diagnosis and treatment. Pinpointing the source is the first step toward effective care. The journey starts with careful observation and targeted testing. Understanding where the problem lies shapes the entire plan. That's how doctors turn a mystery into a path forward. Many causes of hypotonia are genetic, each with unique clues. SMA often shows severe leg weakness and tongue twitches, but the baby's mind is sharp. Congenital myopathies like centronuclear or nemaline myopathy affect face and neck muscles, sometimes causing droopy eyelids or breathing issues. Central core disease is linked to anesthesia risks and affects hips and shoulders. Muscular dystrophies often worsen over time and may involve the brain or eyes. Each syndrome has its own pattern. Recognizing these helps guide diagnosis. The right diagnosis shapes treatment and family planning. Distinguishing between these conditions is crucial for the best care. Diagnosing a floppy baby combines clinical skill and advanced testing. Muscle biopsy reveals structural changes, like misplaced nuclei or rod-like bodies, under the microscope. Genetic testing reads the body's instruction manual, searching for mutations that disrupt muscle function. Panel tests can screen many genes at once, often providing faster, less invasive answers than biopsy. Blood tests for muscle enzymes like creatine kinase help distinguish between myopathies and dystrophies. Each test adds a piece to the puzzle. The goal: move from general symptoms to a precise diagnosis. This clarity guides treatment and gives families vital information. Science turns uncertainty into understanding. That's the foundation for hope and action. A diagnosis of congenital hypotonia changes everything for a family. Early recognition opens the door to therapies that maximize a child's potential. Physical therapists help build strength, skills, and independence. Occupational therapists help build strength, skills, and independence. Speech therapists help build strength, skills, and independence. These therapies don't cure, but they transform lives. Support groups connect families, offering advice and understanding. Community is a lifeline. No one has to face this alone. Knowledge empowers parents to advocate for their child. Every small step forward is a victory. With information, action, and support, families find hope. The journey is challenging, but it's filled with courage, progress, and love.